Mastectomy is the removal of the breast. Now, the good news with mastectomy is that this is not your grandmother or great-grandmother's mastectomy. The mastectomies that we do in this day and age can be done in ways that are cosmetically so much better than what we did historically. And I think part of the history here is important to review. In the late 1800s, Halsted invented the radical mastectomy. And frankly, I was involved with some of those even in my training in the 1970s, where not only was the whole breast removed, but the muscles and as much skin as we could and all of the lymph nodes, and it was absolutely horrible. And so when you mention the word mastectomy, often people, that kind of image jumps into their mind because they remember seeing how disfigured their grandmother was or whoever. Fortunately then, we moved forward into what was called skin-sparing mastectomies, where we were removing the nipple areolar area but saving all of the skin so that we could do reconstruction. And we'll talk more about reconstruction later, but typical reconstruction is done in two stages. First stage involves the placement of a tissue expander, and then a second stage involves the placement of a permanent implant. Now, what I'm pleased about is the emergence now of nipple-sparing mastectomy. And at breastcanceranswers.com, I've got a description of eligibility for nipple-sparing mastectomies, and I'll talk more about that in a subsequent video. But the concept with a nipple-sparing mastectomy in selected cases is we leave all of the skin, we leave the nipple areolar area. Hopefully we can come in an incision down here in the inframammary fold below the breast, and another one here in the axilla or the armpit area, so that when the patient's reconstructed, these incisions are hidden and she's feeling cosmetically really good about herself. Now, one of the real misconceptions about mastectomy is, oh gosh, if I have a big operation like a mastectomy, I'm going to do better. Not true. The survival from breast cancer is the same whether a patient has a lumpectomy or a mastectomy. Now, there's certain times where we actually need to do a mastectomy and not a lumpectomy. And we can talk more about that subsequently. But the bigger the operation doesn't mean, gee, Dr. Harness, I won't need chemotherapy, or gee, I won't need tamoxifen, or one of those other things. As I've said on the video about invasive breast cancer, once we start shedding off cancer cells elsewhere in the body with any stage of invasive breast cancer, we need to treat the whole body. So summarizing then mastectomy, it is a removal of the breast. We are always then finding out what's going on with the lymph nodes at the same time. It also can be done with reconstruction or actually without reconstruction. Some patients choose not to be reconstructed, and therefore we want the skin down nice and flat so it's easier to wear a prosthesis in the bra. But please remember that because this is usually being done for an invasive cancer, sometimes we do it for in situ, often then you do need additional therapies. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.